So, the pandemic has also highlighted inequities in our health system. Prior to the pandemic, the state already had some of the worst health metrics on things like chronic health conditions and maternal mortality. But for those who lose their jobs during this pandemic, many will also lose their health coverage too, putting health services even farther out of reach. What does the state need to do to improve healthcare access?
First and foremost, I'm going to say it's probably the number one. It's so hard to pick a most important issue at this time, and probably my chance of winning would be basically zero if it wasn't if there weren't so many problems that need new approaches and need new leadership. But the number one for me, the easiest problem to solve is Medicaid expansion. We had an opportunity with the Affordable Care Act when it first passed to expand Medicaid in Georgia. And unfortunately, the way that issue is presented is usually an issue where people's racism gets kind of, teased. So when they would talk about it, they would talk about poor people, but they were kind of winking at poor Black people would get this free health care. And you don't want that, right? That would be terrible, because then how would they learn some lesson? But what we've seen is what we were seeing before the ACA, and what we're seeing continuing now is rural hospitals everywhere are closing down because they don't have the money. And the reason they don't have the money is because poor rural white Georgians can't afford health care. And so they have some health problem and they don't go see the doctor. And they either wait until it gets so bad that they go to the ER, or they wait and then eventually they learn to live with it, or whatever. And the solution is to have these people be healthy. The solution is to have every Georgian be able to be healthy. So we start with Medicaid expansion, which, like I said, is super easy to do. We just say, yes, please, we would like the money. And after that, we need to look at, I don't know that I want to wait for Medicare for all to come. I mean, even if the National Democratic Party manages to get the entire federal government in 2000, in November, starting January, I don't know that I want to wait for them to do it and go through all their negotiations and chipping away at what could be a good bill until we get some, not so great thing. And I don't know why Georgia can't have peach care for all, right? And that would be a topic I would want to look at. And I know that it would be really hard because it's very unlikely. I haven't actually checked the math. It might be mathematically impossible, but it's very unlikely, at least, for us to get the Senate. And we'll still have Governor Kemp there, probably trying to prove how Trumpy he is to the National Republican Party, so that the National Republican Party will bless him one day and let him run for president. But I think it's a fight to have. I think that for so long, especially in Georgia and the South, the Democratic Party has let the Republican Party define the narrative and say, this is what we're going to talk about, and we can only talk about these things. And we need to start fighting back and say, no, we need to talk about healthcare for everyone. We need to talk about a living wage. We need to talk about police reform and fully funding education like the Constitution. I think that we have an opportunity here to really, really improve the healthcare that Georgians have access to in a very short time, just with Medicaid expansion. And then in the longer haul, look at some sort of peach care for all.